Akamaguna further urged individuals to report any domestic violence incidents to the nearest police station to ensure proper justice is served. Over 500 persons in Ika North East local government area of Delta State were beneficiaries of a free medical service in an outreach organized by the Medical Women Association of Nigeria, M1. The beneficiaries comprised mostly elderly men and women as well as children who gathered at the palace of the Obi of our Kingdom in Ika North East local government area of Delta State. Our correspondent Charles Bassi was there and now reports.
In keeping with its mission of ensuring the improvement of the health and well-being of women and children in Nigeria through advocacy, education and services such as this medical outreach, the Medical Women's Association of Nigeria, M1, brought together hundreds of people from communities within and around Ika North East local government area of Delta State.
Here at the town hall of the palace of the Owa Oyibo Kingdom, the people have gathered to get free medical care, courtesy of the Nigerian medical women.
These female medical professionals with specialties in various fields were all out and set to see a large number of patients who were presented with diverse medical conditions ranging from malaria, cancer, high blood pressure, skin infections, dental challenges and poor eyesight, amongst others. Many of them looking very unstable and frail, while several others were indigent and not able to afford even the cheapest treatment, even if they ever had access to one. What informed this outreach by the Medical Women Association of Nigeria? Professor Rosemary Obaze Ogu is the 24th National President of M1.
Because we know that healthcare, not everyone can access healthcare, and it is worse in the communities. That is why we focus on communities. So we carry out outreach in every nook and cranny of the country. We've done so many outreaches this year, but we haven't come to Owo Oyibo before. And so this is an opportunity, a perfect opportunity, coinciding with the annual general meeting of M1 Delta, to say to the Owa community, we are here with the might and strength of the Medical Women's Association of Nigeria, bringing specialties from all across medicine. We have eye doctors here, we have ophthalmologists, we have the ENT surgeons, the ear doctors, we have the obstetricians, gynecologists. Dr. Kuba just left. We have the physicians, the general surgeons, the plastic surgeons, the internists, radiologists, we have them all here. Then the general family health physicians, we have them here coming to give back to society. This is volunteer work. We're volunteering. We've taken off time just to do this, to give back to society, and especially to this society where I was born.
After paying tributes to the royal father, His Royal Highness the Obi of Owa Kingdom, Dr. Emmanuel Efezomo II, the medical women got his blessings and approval. Thereafter, the free medical and surgical outreach began in earnest with the registration of the patients, followed by the diagnosis and treatments. Drugs were also dispensed free of charge to the patients with the leading pharmaceutical company, LB Pharma, manufacturers of Amatem Top Gel Malaria Capsules, Derivit Women and Derivit Perfect 3 brands donating. Some of the beneficiaries who spoke to Quest Television News could not hide their joy.
They have given me one free eyeglass for reading. I feel very happy. May God bless them. Thank you.
I'm having a problem from eyesight. My eye, I don't see where it could be like cloud in my eye. Now I thank God as I come now, they don't give me medicine. So by the grace of God, I pray, may this medicine work on my eye, make it see road the waka.
Also speaking, the Delta State Chairman of the Medical Women's Association of Nigeria, Dr. Olive Ogele, gave insight into the array of treatment given to the teeming members of the Owa community, which trooped out to benefit from the free medical and surgical outreach.
Consultations, we're going to have free surgeries, fibroid surgeries, cataract surgeries. So a whole lot is going on. We're going to screen, we're focusing on fibroid surgeries and cataract surgeries. So we're going to, this is a hall, so this is not a hospital. So what we're doing is we're going to screen them, and within the next 1 week, at most 2 weeks, those surgeries will be done free of charge.
While throwing light on how the serious cases of surgery would be handled, the Permanent Secretary in the Delta State Ministry of Environment, Dr. Minine Oseji, who is also a member of the Medical Women Association of Nigeria, explained how the association was able to fund this humanitarian health service to the indigent people of our community.
We have been able to pull resources from different places. We have called for donations, and several groups have donated drugs and consumables. And the medical women also contribute on their own. And from time to time, through the annual subscription, a portion of it is used to make sure that we serve humanity. So we get our resources from different sources.
She also had a word of advice to the beneficiaries of the medical outreach.
I want them to try as much as possible to always avail themselves of these kinds of free medical care. Some of them may be diabetic, they wouldn't know. Some of them may be hypertensive, they wouldn't know. And then some also are indigent. They already know that they are diabetic and hypertensive, but they can't afford the drugs. So that's why when they come here, they can get the free drugs that will last them for at least some time.
With this exercise, it can be said very confidently that the people of Ika North East local government area will be the better for it in terms of health. Health, they say, is wealth. And for a long time to come, the people will ever remember this service handed to them by the Medical Women Association of Nigeria. From Ika North East local government area, I am Charles Bassi, Quest Television News.